What is a bump on the nose? A bump on the nose can either be caused naturally or caused by trauma when you're younger. It can often lead to a deformity which just doesn't give you that straightness of the nose and that smooth context. Bumps on the nose are more common from the side profile. That's where you see them more frequently, and that's where patients tend to be more concerned about them. The nose is a central feature of the face. It's the midpoint where we see everything. It's often most noted from the side profile, and this is where patients will complain of their most biggest concerns. Typically saying, look at that bump on my nose, or do you see my droopy tip? And the nose being right in the center of the face is easily picked up. However, when we make adjustments to it, it changes your confidence, it changes your appearance from both the side profile and the front profile. And this is what we're looking to achieve. A small change on the nose can give dramatic responses across the whole face. We've got the non-surgical rhinoplasty and we have a surgical rhinoplasty. Now, I'm an expert in the non-surgical rhinoplasty, so for full information about a surgical rhinoplasty, get a surgical opinion. From what my patients have told me, however, a surgical rhinoplasty is a great long-term permanent procedure. However, the downtime, wearing a cast, and I know that 1 in 2 often don't have the best results and require revision surgery. And you have to take that into balance with everything we're talking about. Whereas a non-surgical rhinoplasty, typically an appointment's around 30 minutes. I can make all the adjustments to your nose using dermal filler, a single syringe. The downsides we look at predominantly are bruising, up to 3 days, slight swelling over a couple of days, but the results are instantaneous. This means that you can go out and enjoy the features of that nose there and then. This is a great option for those who are just looking for minor corrections and those who feel, actually, I don't want to go under a general anaesthetic, or I don't want to go under the knife. And this is a great solution to counteract all those problems. It's not uncommon that I do a non-surgical rhinoplasty for those who have had rhinoplasties previously, because I know that the results aren't always perfect, as it takes 12 months for everything to truly settle down. And that's where revision with a non-surgical rhinoplasty can be done on top. The non-surgical rhinoplasty is one of the key treatments we do here, and we love it because it's one of the most value-based treatments and patients get awesome results. And that's what we really want to see in our clinics, is true, genuine based results. So I'm going to take you through today what the non-surgical rhinoplasty is, who it's good for, why we do it, and how we do it. So let's start with the basics. What is a non-surgical rhinoplasty good for? The best answer to this is a bump on the nose. Typically those who have a crooked dorsal on the tip of the nose and they've noticed it. Other places it could be used if you've got a droopy tip, or if you find that your shapely nose isn't quite there. The non-surgical rhinoplasty is great for those who are thinking about surgery but not sure how that change is really going to work for them. It's a great middle ground, and it's been taking the UK by storm. The reasons we like doing this: it's quick, it's simple, you see the results pretty damn quickly, and in fairness, a lot of patients don't want to go with the results of a rhinoplasty because of all the downtime, and the possible appearance may not be what you're looking for. We use a lot of different techniques, but essentially we're talking about the 4-point rhinoplasty. We use small amounts of dermal filler to correct different deformities on the nose. So for example, if you've got a bump on the nose here, we would look at placing filler higher up, above and below, to give it a more smooth appearance. If you've got a droopy tip, we'd be looking to support the nose by putting filler in the base of the tip and in the base of the nose itself to giving it that support. Here at Dr. Estetica, we like to choose our patients for the right treatment. So the first thing that we want to do if you're considering a non-surgical rhinoplasty is to have a consultation. During this, we'll go through your full medical history, your past history, and why this feature of your face concerns you, and what it is you're looking for adjustment. These consultations are done with doctor, and it's important that we get your views on what you're looking to change. After this, we will take your photos and ensure that we've got a full medical history in order to complete the surgery. After we've done your medical history, we then take your photos to highlight and showcase the before photos of what we're looking to change. Before the procedure commences, we will clean the skin down with an antiseptic solution. This ensures that the surface is clean. All our products are sealed and brand new, and we ensure that we use the highest quality grade hyaluronic acid to give you the best result. Treatments are typically done with needle formation, so we do use a bit of numbing cream just to make it more comfortable. Depending on the area of concern, we can be injecting into 3 or 4 different places to give that final outcome. Procedure takes around 15 to 20 minutes and results tend to last around 9 to 12 months. What are the outcomes we can expect with a non-surgical rhinoplasty? The goal here is to provide you with the bespoke nose that you're looking for. So if you have a bump on the nose, we want to smooth that bump out. If you have a droopy tip, we want to lift that tip up and create that sharpness. If you find that you've got a small nose, we want to increase the height of the nose and make it the size that you're requiring. Now, we can only do limited pieces of work, but those pieces of work can make great changes to the nose in a specific way to you. Most procedures last around 15 to 20 minutes and the results last around 12 months. Now this is an average, it does depend person to person. Patients often come to me with the smallest concerns about the nose. The reason why this is the most important treatment for them is it changes their confidence. It gives them the confidence that they need to go out into the world and do what they want to do. So whilst you might not think it's a big change for you, it's the change in confidence which is the best feature. And this is one of the reasons why this procedure is loved by many all across the UK. It's that change in how you feel, what it makes you feel, and how you can look in photos that gives you that appearance where you feel fresher and more confident in yourself.